This year, doctors say it's more crucial than ever to get your flu shot. Why is that? You can probably guess, but we'll explain.
And since COVID-19 and flu symptoms can overlap, can you tell the difference between the two? Joining us now to help answer those questions and more is Dr. Nicholas Testa, Chief Medical Officer with Dignity Health Southern California. Always great to see you. Thanks for joining us. How is the pandemic going to affect the upcoming flu season?
So we don't exactly know what this flu season is going to look like. But what we can do is we can look at the flu season that's already occurred. So you look to the southern hemisphere because it occurs at the opposite time. And what they saw this year was that there was almost no flu season in the southern hemisphere. That was probably because of, one, good immunizations with flu shots, but two, all of the social distancing and precautions that they put into place, which really helped mitigate the flu. So again, we want to be optimistic for this year.
But isn't that something to be excited about? The possibility, maybe, because there is a flu vaccine, that we won't have the big flu season? I mean, that's a positive?
That is definitely a positive. And if we can continue practicing good social distancing and infection prevention measures, we can definitely mitigate the flu. The flu is not as infectious as COVID-19. That's one of the things we're seeing. So the measures that we're putting in place really work. The problem is, like, look at your last segment. Are there parties going on? Are these super spreader events going on? We have to stick it out through this flu season.
Mm-hmm. Yeah, that's a good point. Now, for those who don't know, is it possible to get the flu and COVID-19 at the same time? And can doctors, determine that you have one or the other or both?
So you can get the flu and COVID-19 at the same time. And we're ramping up for our rapid testing to not only be testing for COVID-19, we'll simultaneously test people for COVID-19 and the flu since we're starting flu season. There's only been one study that I reviewed that was out of Stanford that looked at co-infections with COVID-19. We don't know what happens. Does it make it better? Does it make it worse? We just don't know yet.
But if you have simply a cold, or let's say sinuses, you could sneeze, and if you have COVID, I mean, you're still spreading it like that. I guess what I'm saying is, even if it doesn't affect you deeper, you can still spread, and you might have both.
Well, absolutely. Absolutely. And that's why, particularly for this flu season, we are going to really need to stick out the social distancing and all the measures that we put into place, because we just don't know. You could have the flu or COVID-19 or some other common cold. And we really want to sort of mitigate all the transmission we can.
Yeah. So an unprecedented number of people are expected to get flu shots this year because we've been talking about it and urging people to do so. Talk about the surge in demand, and will we be able to meet it?
Yeah, so, usually the United States prepares about 175 million flu shots. This year, they increased that number by about 20 million. So I think it was 195. So, I think we will be ready to meet it. When I look at the preparation that we're already doing across Southern California, both at the city and the county and the individual hospital and health system levels, we're doing things we've never done before or haven't done in a long time, drive-through flu immunizations and so on, basically because it works on the heels of COVID-19. We're all poised to do this. So we're getting out there and going to get the vaccines going.
And one last thing about the flu, I don't want to be overly optimistic, but the great thing about the flu is we have treatment options for it as well. Not only do we have the vaccine, but if you get it, we can treat you much better than we can treat people with COVID.
Definitely true, Phil. And I love you being optimistic about the flu. And we do have therapeutics that can treat the flu. But what we can't do, and this is where I caution everybody why it's so important, is if we have a terrible flu season this year and the hospitals get inundated with volume, we're not out of this in Southern California, right? Our ICUs still have quite a few COVID patients. So if we get hit with a big flu season and the COVID population, again, that's going to put a strain on our system that we just don't want to see.
Exactly.
Yeah, all right.
Exactly.
Thanks again, Dr. Nicholas Testa from Dignity Health Southern California. Thanks for joining us. We'll see you next time. And still ahead.